Diabetes can affect the back of the eye in a couple ways. We know that diabetes affects the cell walls of your blood vessels. It weakens them. And in the eye, the blood vessels here and here become more permeable, and that's where blood and exudates or white blood cells can escape and cause damage to the eye. We never want blood outside of the blood vessel system. So when you have blood in the eye, it's kind of like internal bleeding. That can get into the back of the eye here at the macula, which is the 20/20 part of your vision, your most precious part of your eye, which the macula then sends your image to the optic nerve, which then processes that image to the brain, and that's how the eye works. So this is an eye that you can see has quite a bit of blood in that. You can see where all of these dark spots is blood and should not be here. And this is a pretty severe case, but this is why your doctor is going to want you checked out at least once a year. If we find blood, then we're going to monitor it every 6 months. In a case like this, if we do find blood, it might require laser in the retina, as well as an injection based on the amount of fluid you have. We're fortunate enough to have injections now which can clear up any edema at the macula or fluid as well as blood. We know with diabetes you want to control your A1C, which is a measurement of your blood sugar over a past period. I think it's 4 to 6 weeks, possibly even 2 months. You know, an A1C of under 8 is a good goal, even 7, and that's something you work with your physician. We will be sending a report to your physician of the status of your eyes and letting you know where you're at in the diabetes. But very important to get your eyes checked at least once a year with diabetes. Again, back to the leakage. You can imagine how small the vessels are in the eye. It is fortunate that the eye is the one place that you, without innervation or having to scope the body, if you will, that we can see blood vessels working without any type of surgical procedure. The other thing to go in diabetes is, you know, is fingers and toes. So these are your smallest blood vessels in your body that are going to be affected first. And that's what we call neuropathy and retinopathy. Quite often, your eye doctor will be one of the first ones to detect the diabetes. You know, the symptoms of diabetes, you've got type 1, which is juvenile, and type 2, which is adult onset. Typically, type 1 is controlled by insulin. Type 2 can be an oral medication if your blood sugar is not too far out of control. But how we can detect that is, 1, blood in the back of the eye, but 2, the blood sugar can affect the lens in the eye, which will change your prescription. So if somebody's got a really high blood sugar, then they can become more nearsighted and their prescription will be out of whack and not seen very well, and they'll come in and go, wow, my eyes have really changed, where indeed it's your blood sugar. As soon as we get the blood sugar back under control, and quite often we've checked the blood sugar here and it's been 400 or 500, then that prescription will go back to where you were to begin with. So any vision change that you see that is in conjunction with weight loss or frequent urination or excessive, drinking, people will report that they will drink a gallon of water every 2 hours. Those are symptoms of diabetes that you would look for.